Here, do I need to turn this up? It's as loud as it will go. Bring him out. Bring him out.
Good morning. Let the record reflect
Long John's
that
on.
the
I can
state's
see him.
President, defense counsel, and the defendant are present. We're here on the state of Florida versus Wade Stephen Wilson, case number 19 CF 568. And we're here for Spencer hearing this morning. Are both the state and defense ready to proceed?
State's ready, Judge. Defense is ready, Your Honor. Thank you. Yes, sir.
All right. Very well. If everybody will announce themselves for the record.
We are Andreas Gardner and Sarah Miller on behalf of the state.
Good morning. Sarah Miller on behalf of the state.
Kevin Shirley on behalf of Mr. Wilson,
Lee Hollander on behalf of Mr. Wilson.
together with Ms. Perez on behalf of Mr. Wilson.
All right. And Mr. Wilson's present. All right.
Judge, my first witness is a neurologist, and he's lost it, so I guess somewhere in the building trying to find the courtroom. So
He looks hungry.
that's not him.
Is that him?
So we just need to wait.
We just need a minute.
Okay.
I just need
Well,
to track him down.
no, you don't get one.
All right.
We were all here with our long johns on time. Look at Wade's little dirty sock tapping on the floor. Doofus. He's trying to look. He thinks he's tough. Look at him.
Let me ask this then of defense counsel. How many witnesses are you planning on calling this morning?
I anticipate one.
Okay. Very well.
Excuse me, Your Honor. For the court's benefit, once again, I thank the court for the extra time. We had two doctors that had the opportunity to interview Mr. Wilson during the interim, so everybody got their work done to the best of their ability. We have elected to only call one of the two witnesses.
Very well. And you say that witness is in the building, as far as you know.
He don't know. Oh, let me just go check. I have no clue.
Call
Okay.
and find out exactly where he is.
Judge, if we could just, I would like to make a little more of a record of the other doctor that they listed. I believe it was Dr.
Brandon,
Mark Brannon, is that correct?
Michael.
Michael Brannon. He did evaluate him. The defense is choosing not to call him, and it's my understanding that what he would have to say would be cumulative to what Dr. Mills said and what he testified to the jury. So I just want to put that on the record for appellate purposes.
This is as loud as I can do it. It's not me.
Is that correct?
That is correct, Your Honor.
Okay.
It's as loud as it's going, guys. I promise. Look at him. Like a ventriloquist dummy.
I need to clarify. Obviously, Dr. Brandon is not a neuropsychologist. He is a psychologist. So he had a different battery of tests that he ran. His conclusions would do nothing to further our position of Mr. Wilson's position in the case. So we're affirmatively electing not to call him in the case.
Okay.
That's not how you spell volume, but thank you, Lori. His eyelids look yellow. It looks sick. Look at him. He got jaundice. He must have ate a bad taco last night. He looks. This dude. Look at his eyes. Look like you've been crying, brother. Someone's giggling behind the. Y'all hear someone giggling in the courtroom? They must be listening to my stream. They should. They're talking about his long johns. Long jaundice. Oh my gosh. Underrated comment. He's got long jaundice. Because he's just thinking, yeah, all these women are out here watching me right now thinking I'm so cool. He doesn't know there are 6,500 people destroying him on YouTube in the chat. What's going on now? Wade, they don't even got their guy in the building. He got lost. He's in the bathroom. They don't know where he's at. He should be here any second, Judge. Wade, we heard you on these calls sounding like an idiot. Well, I don't know why you sitting there. Oh my goodness. What's that tattoo say? Glory? Oh yeah. You getting your glory right now, brother. I promise you. Good point. Probably didn't. His skin looks sickly. I mean, besides the stupid look at his eyes. They're yellow around him. Is he able to watch your videos? No, ma'am. He's incarcerated. No, ma'am. I'm loud. Okay. Let me turn it down. Is that better? Guys, the sound on Law and Crime is low. This always happens. Trust me. It's always low. Wouldn't doubt it. No, he's not in prison yet. He's just in the county jail. You got to get sentenced first. Thank you, Diana. Look at them. Look at them. I don't know what's going on. Look at Wade's little foot. I know those socks are wet. Look, y'all see his long johns poking out from under his little jumpsuit. And now that's his only pair of long johns too. He's had those for 5 years. $7,200 in the chat. And I hadn't seen a single blue heart or a Wade wife yet. I told y'all I got a trick for him. Now watch right when I say that. Somebody will pop in. Please slow the chat down. I already got it slowed down by a minute. There's 7,300 people in here. It's just going to be fast. This is just awkward. Where is your expert, sir? Look at Wade. He thinks he doesn't realize that everyone has found out what a doofus he is. Like, we have heard hours upon hours now of you being a begging little boy, begging everybody for money. If y'all don't mind, everybody hit that like button, please. Let's get this out to more people who need a good place away from what's going on in the other chats on other channels. Look at him. Man, he's sick. Look at him. He's withering away. Wither Wilson. That's a good point. Somebody said he's trying to act like he doesn't care about a sentence, but you can tell he does. He does. Look at him. He's putting on such an act.
Do you want to check again? It seems like
Maybe check the bathroom, knock on one of the stalls, look at, check for feet on the toilet. Maybe he's in there. I heard his Starbucks order this morning. He got 2 shots of espresso. Probably tore him up. Good one, Stevie. Just check something over here. They got 11,000 watching on Law and Crime. We have almost 8,000. That's pretty wild. Pretty wild. Oh, Wussy Wilson. Look at his little feet. Is that the guy? Lips getting dry, huh? Lips drying up. Look at him.
I'd rather not right now.
He's just got one of those faces you could punch. Look at him. How is some grown man in prison who's been there like 17 years, how are they not going to just be like, all right, buddy, you're getting beat up. I bet you won't walk on the cell block looking like that. I bet you won't walk around there looking with that face. I have no idea who those people are. Hopefully not. They're paying this expert $400 an hour and he can't even show up to court on time. That's crazy.
Is your witness here?
He's in a long line downstairs. I thought he was going through the scanners. He was about to go. He's not about to go through the scanners. Evidently, half of Lee County has been out of the courthouse. He's stuck in line, so.
Is there any way we can get him expedited?
Expedited. Go down there and get him. Like, can we expedite the expert extra quickly, please? Tell the man just come upstairs. We're waiting on him. Come on up here, brother. Wade's mouth is getting dry. He needs a cup of water. He's in line for the kiosk. Who said that? Doofus.
Oh, okay. All right. Are we ready to proceed? Mr. Shirley? Wait 1 second.
Thanks for joining us, Mr. Shirley.
All right, Mr. Shirley, are you ready to proceed?
We are ready to proceed.
You have your witness here. And who are you calling?
Dr. Mark Rubino.
All right, sir. If you'll raise your right hand, do you swear or affirm testimony you give will be the truth, the whole truth, nothing but the truth? All right, you may take the stand.
Just want to get this up.
I can't slow the chat anymore. There's almost 9,000 people in here. It's just going to be fast. I've already got it as slow as it'll go.
Is there a way to make that bigger? Yeah. Please tell the judge your name.
My name is Mark Patrick Rubino.
Mr. Rubino, how are you employed?
I'm self-employed
All right.
as a neurologist.
Are you an MD?
I am.
Can you give us a brief background of your educational history?
Yes, after graduating from high school, I entered into a 6-year BS&D program through Kent State University in Northeast Ohio, and then went to medical school at Northeastern Ohio University's College of Medicine. Excuse me?
Yeah, can you speak up a little loud?
Yeah,
Medical
please.
school at Northeastern Ohio University College of Medicine, which is now Northeastern Ohio Medical University. And then I did my transitional residency at Summa Health Systems in Akron, Ohio, and then neurology residency at USF in Tampa. And I've been practicing in Naples since 1999.
Right. You specialize in neurology, is that correct?
I do.
Are you board certified in neurology?
I am.
Have you ever testified as an expert in a case and allowed to give your opinion in a courtroom before?
Yes.
How many-
This would be 78 times.
Sorry.
And the majority, if not exclusively, is you're a witness for the defense, are you not?
I am, because I've never been asked by the state.
Obviously, you have nothing in your background or anything that would prohibit you from testifying on behalf of the state, do you?
Not at all.
You just never had that opportunity.
Correct.
And are you being paid for your evaluations and your testimony here today?
I am.
And at what rate?
$400 an hour?
Is that the rate approved by the JAC?
It is.
Did you have an opportunity to become engaged with our defense team?
I have.
And do you recall just approximately when that was?
Sometime in March, I think.
Do Do you know Wade Wilson?
I met him.
Did you had the opportunity to talk to Mr. Wilson?
I did.
Okay. And how did you talk to Mr. Wilson? In person?
You can say that. The first part was in person with him basically bound and shackled. And that's when I did my exam. And the second part was with him still bound and shackled behind a glass wall.
Okay.
But that was in person, I take it.
All right. The first time you visited with him, when he was bound and shackled, but you actually had contact with him, for what purpose was that contact?
That purpose of that was for my exam, my neurological examination.
Okay. What type of neurological examination?
Just a neurological examination.
Okay. Do you run several tests?
Yes, it has several parts to it.
All right. Why don't we go through the parts one at a time? What's the first part?
Mental status.
Okay. And how do you test that?
I would usually do a Montreal Cognitive Assessment as a formalized version of a mental status.
I'm going to have you speak up a little louder.
Okay.
Sorry, it's hard to hear you.
Montreal Cognitive Assessment test.
Put some bass in your voice, sir. You're already
I'm
late.
sure the judge has heard this before, but for the record, can you tell us what tests or what examinations comprise this?
Of the mental status?
Yes. The cognitive test
Yes.
that you said was the first test you had to perform.
It's broken down into visual, spatial, and executive, naming, memory, attention, language, abstraction, delayed recall, and orientation.
Okay. And so how do you test for these?
First part, I have them
Test?
do the first part. Very first question is something called trails, where you connect letters, numbers, in sequence in a pattern that's been established.
Okay. And was he able to do that?
He was able to do that, yes.
All right. What was the second part of the examination?
Copy a cube.
And was Mr. Wilson able to do that?
He drew something, but it wasn't a cube.
Okay. What was it?
It was
what did it look
Duty
like?
Ron, welcome.
It was a
Good to
functional
have you.
square.
Okay.
The best I can describe it.
And I'm going out of order a little bit here, but do you give scores to each one of these?
Well, each counts as a point, and then these points are all added up to a final score.
Okay. What was the next test after the cube?
Clock draw.
All right. And describe how that is conducted.
You're supposed to draw a clock with all the numbers on it, which pretty seems straightforward, but it's amazing how some people can't do it.
What?
I'm still having a hard time understanding what he's saying. I don't know if it's just volume or.
I'm trying to turn it up as loud as I can. If you could just project louder,
All right, I'll talk louder. Is that better?
that's better.
Yeah,
All
that's
right,
what
so
we've
the
been
clock
asking you to
draw
do, sir.
Is a test where people seem to sound pretty easy, but a lot of people mess it up.
So
Really?
how did Mr. Wilson do on that?
The numbers are on there, but there's no 12. He had put 1 in the place of the 12 in the first place, so that throws the numbers off.
Doofus.
And then he just put a couple X's in the center. And at this point, I think he got a little frustrated.
All right. So he didn't actually draw hands to the clock when you told him what time to reflect on the clock.
No hands on the clock, no.
Just 2 X's?
2 X's.
You said Mr. Wilson appeared to be frustrated to you. How did he express himself?
I can't do this. Part of it was the police were there because not police, the officers were there, and he was just getting very paranoid and very anxious that they were watching him.
Did he was he asked to perform any other tests?
Yes, actually, I did the rest of the test in the rest of the MOCA in the blocked exam room.
Okay, so the officers were not present.
Correct.
They were not able to observe.
We're
Mr.
making
Wilson.
them nervous.
Okay. So what other tests did you ask him to perform?
At that point, I went on and did cranial nerves.
What is that?
It's assessing cranial nerves. It's the nerves that arise out of off your brain.
And how do you test for that?
Well, I don't test for one because it's olfactory.
What?
I really don't test for 2 either because that's vision.
Oh, well, I didn't even do
I
any
test
of
for
it.
3, 4, 5, and 3, 4, and 6, which is extraocular movements.
And why are you looking for those?
Well, it's part of
He doesn't know.
radiological examination, but what I found was he had some horizontal jerk nystagmus on bilateral gaze.
Okay. What does that mean?
Means when you test his eyes left to right, you'll see a couple of jerks in them, jerks in the eye movements as you go to the left and as you go to the right.
Okay. Is that to be anticipated of anybody who takes this test?
Typically, people have normal movements. They have normal saccades, which is the movement of the eye, and then the jerkiness, as known as nystagmus, which could be from vestibular disease or midbrain disease.
Okay. What did you do next?
Let's see.
Just for the record, did you bring your file with you?
Yes, I did.
And are you referring to your notes occasionally?
I am.
Okay.
Yes. Wade. There's a 12 on the clock, brother. I just want you to know that.
Cranial nerve 5, which is sensation to his face, which is cranial nerve 5, which is sensation to his face. Cranial nerve 7, which is facial symmetry when smiling, etc., and that was normal. Cranial nerve 8, check hearing. Cranial nerve 9, check palate. And does uvula go up when you say ah? Midline, that would be intact. Cranial nerve 10. Can't really check 10 because that's more GI stuff and heart related. Cranial nerve 11, check shoulder shrug. And cranial nerve 12 is hypoglossal, which is tongue, and make sure his tongue goes out straight.
Well, as a result of these individual tests, did you come to any conclusions?
That he had horizontal bilateral nystagmus.
That means his teeth are
That's the
crooked.
positive finding in his cranial nerves.
Okay.
And then there's more to the exam.
All right. What else did you do?
Motor examination.
How do you test for that?
You physically test the strength of each muscle.
He doesn't even
Do you
know.
find that to be challenging?
It was challenging because he only had one arm free at one time because he was bound.
Come on, man.
But I was able to get it done with extra time.
Okay. Did you reach any conclusions as a result of his performance of that?
His motor examination was normal in terms of strength. His tone was abnormal as he had cogwheeling on his right side.
Had what? I'm sorry.
Cogwheeling. It's a test where you passively move the arm and you feel ratchetiness in his arm. And it's typically a sign of Parkinson's disease, but it's also found in people who are subjected to antipsychotics at some point.
In your research, did you determine that he had consumed antipsychotics?
He had been on many, many medications, and there were some that were antipsychotics, yes.
Okay. So this test basically confirmed that as
He's
it
been-
relates to Mr. Wilson?
He's been treated for mental health disease.
Did you have him perform any other tests?
The next test I did was deep tendon reflexes.
Okay, and how does he test for that?
I slapped
I
him.
take my reflex hammer and I tap tendons in his arms and legs.
Like a doctor does when you're sitting on the edge of the
I'm
table and taps your.
I am a doctor.
I understand that.
Oh, are you?
So how did he perform on that?
He had decreased reflexes in his arms. He had 1 out of 5 in the biceps, bicep and brachioradialis. 0 at the triceps, and that's bilateral. His patellas were brisk at 3 out of 5, and his ankle jerks were normal with downgoing Babinski.
Oh,
What is that?
Babinski test is that you strike the bottom of the foot, look and see where the toe goes. If it goes up, that means there's upper motor neuron problem.
Okay, and what was the result of his examination?
That was normal.
It was all right. Okay.
his
Did you
feet
have
were
him perform
smelly.
any other tests?
I tested sensation, which was normal, to temperature, vibration, and light touch. I had him do coordination with the finger to nose test.
Okay, how did you do on that?
On the right, he did okay, but on the left, he had some what's called pass pointing. He would miss the object. I think it was also kind of my opinion at the time. He was a little impulsive, just doing things, just very haphazard.
Any other test, doctor?
I watched him walk, and I checked the Romberg. Both those were negative.
Does that mean that's normal?
Yes.
Okay. As a result of these tests, did you have him perform any other tests?
While I was there, or after the boards?
While you were there?
No, I just took a history.
Okay.
Oh no, I
So you
forgot.
talked to Mr. Wilson about what had happened to him during his lifetime.
Yes.
Did you glean any information that you determined was important to your later diagnosis?
One issue is that he was pretty normal up until 11 years old or so. At that point, he told his parents that he thought he was going crazy. And in fact, his sister, Dr. Wendy, had said that he had started getting mental illness at that point, but that's not my field. I'm going to get into head injuries. That was the first thing he told me, though. Well, when I asked him about childhood head injuries, that's what we talked about. He was okay until about 11 years old.
I need you to project a little louder, sir.
That he was okay until about 11 years old. And then things went awry.
Oh yeah.
Okay, did he tell you about any head injuries?
Yes. He didn't tell me when they happened.
They happened in jail.
Where it wasn't when he was in
Got
Tallahassee.
beat up.
How did he sustain the head injury?
He was a passenger. The driver rode off the highway and hit an oak tree.
Did he lose consciousness?
Yes, he his head spidered the windshield. I asked him if there's a spider shape on the windshield, and he said, "Yeah, that's usually what happens when people wear those seat belts and get into a car accident." He went to the local hospital, but he left AMA
What does that mean?
against medical advice. He didn't wait to get assessed.
Did he sustain any other head injuries that he reported to you?
The second MVA, also in the Tallahassee region, close to the beach. He was leaving the beach, but he was on probation. And the driver somehow also hit a tree. I don't know what's wrong with these drivers, but
Sir, we don't know what's wrong with you.
And they all basically got knocked out. When he came to, he started running because he was on probation and didn't want to get arrested for being out of his jurisdiction.
So he never made it to the hospital.
He made it to the EMS because he got worried about himself. He went to EMS to get checked out, but then he refused transportation.
Did he ever report any injuries he sustained as a child in sports or anything?
Thank
yes.
you, Panda Place.
Playing football, he notes at least one concussion where he's knocked out. Playing baseball, he notes at least one concussion while in running bases.
Now, did you have a chance to review any other materials before you prescribed any further testing?
Yes.
What materials did you have a chance to review?
It seems like endless amounts of jail medical records.
And did any of those jail medical records corroborate what Mr. Wilson was telling you?
None of the head injuries, but definitely for psychiatric disease.
And what did these records, how did they enhance your opportunity to diagnose Mr. Wilson?
Only in that he'd been diagnosed with major depression, bipolar disorder, and treated for these disorders for years of being in prison.
No, that was the doctor.
Jails, for that matter.
No, that was me.
For schizophrenia?
He was treated for schizoaffective disorder. That's another psychiatric diagnosis he had obtained. but there were no head injuries within the records.
Did you have an opportunity to evaluate some gross testing material provided to you from Dr. Eisenstein?
Yes, but as I mentioned, I'm not a psychiatrist or a psychologist, and that really doesn't make sense to me.
Okay. So
10,000 in the chat.
No.
All right. After you had conducted all these tests and you reviewed all these records, did you prescribe any further testing for Mr. Wilson?
Due to his self-reported head injuries, as well as some physical findings that support the potential for traumatic brain injury or head injuries, I ordered testing.
What tests did you perform?
I ordered a MRI of the brain.
As loud as it will go. I'm
Formula
sorry.
3T MRI with DTI, that's diffusion tensor imaging, as well as neuroquant. I also obtained a CT PET FDG, fluorodeoxyglucose, in order to assess function of his brain.
Okay. Were any of these tests performed?
The MR of the brain and the DTI were done. Neuroquant was not done, nor was the CT PET, the FDG CT PET.
Okay. Were you provided the results of these tests by Gulf Coast Medical Center?
I was.
And did they also include another test that had previously been performed on Mr. Wilson?
Yes, a CT scan of his head done the year before.
And did you review the CT scan?
Yes.
And did you find it of any value in your diagnosis?
The CT scan showed no evidence of acute hemorrhage or stroke, as the report says, but you can see some lateral asymmetry on this CAT scan as well.
Okay. May I have a moment, Leron?
You may.
Wade. Their sound just went off, sounds like. That's not me. I don't know. Hopefully they just turned it off for a second. I don't know. Yeah, it's not me. I'm pretty sure. It's long crime. Their sound went out. Let me check on my phone. Yeah, it's muted. It's muted on their channel, guys. It's not me. I just checked. I mean, it's about the only place to hear it. So, I mean, we just got to hope they get it right. I know their chat is telling them that the audio is messed up. So hopefully those guys there will get it working. Oh, it's because they are at sidebar. Duty Ron texted me and said it's because they're at sidebar. Sorry, guys. So it's all good. Hey, I'd rather it be that than them have technical issues. So it'll come back. What do you think she's saying? Yeah, Wade, there's people on YouTube. They're laughing at you. Your long johns. That was a bad attire choice. So that's Wade's brain, huh? Shaped like a kiosk, oddly enough. I respect this person for making their actual YouTube username meet me at the kiosk. Real quick, I want to say hey to the 10,000 people in here, man. It's like twice what we average, so welcome if you're new. We're all here to just see Wade get justice that he deserves. The death penalty.
Yeah, I'm sorry. You're gonna have to speak up louder, or Come back to the microphone.
This is the left lateral ventricle. It's slightly bigger than this ventricle. That's called ventricular asymmetry.
Speak up,
Okay.
brother. Dang.
All right. Is there any way we can move a microphone closer?
Yeah.
Or-
Dr. Little Voice over here. Get him a megaphone. Look at his nose shining. He's getting oily. He's sweating.
Better?
Not yet.
Oh, I can turn it on. Is that better? Oh, there it is.
That's better.
There we go.
Okay, I don't know if anybody can see this, but I measured the ventricles to show that there's a difference. NeuroQuant is very helpful at showing us the asymmetry because it measures this stuff, but we had no NeuroQuant, so I measured it myself. On the right side, which is your left, here, that's 3.55 millimeters. On the right side, that's 5.6 millimeters. So that's quite a difference in the ventricle size from one side to the other. Next slide. And here you can visually see it where the left or the right side is bigger than the left side. But also I'm going to point your attention to all the space here. In my opinion, his ventricles are very small for his age.
Small ventricle Wilson.
The ventricles are the space inside the brain where cerebrospinal fluid is. The size indicates if there's too much water in the brain or too much brain in the brain.
Too much brain in
His
the
ventricles
brain.
are too small, which tells me that he likely has a pretty good sized brain. Which is why any amount of atrophy in it is significant.
I interrupted you. I'm sorry, Doctor. You're pointing out to the spacing.
So the space, you're looking at space all around his brain. Nothing. Space in between. And then up in front, you see the space. So the space in front of his brain. So that indicates some frontal lobe atrophy. Not a lot of atrophy. He's got some frontal lobe atrophy. Next slide. Back to the ventricle. This is another location just to show that I'm not just cherry picking. Is right, which is on your left, is 8.03 millimeters. On the left, which is your right, is 9.48 millimeters. Note this is all less than a centimeter. And again, here's left frontal. I'm gonna get back to that. Left frontal.
Okay, great.
Yep.
Yep.
All right, now we're gonna start talking about atrophy.
What is that?
There's too much brain in the
Atrophy
brain,
is
he
where
says.
the brain shrinks and pulls away from the skull and creates more spinal fluid on the other side of it. His brain has really no atrophy other than in certain locations. And where you see it is right in here and right in here. This area is where the amygdala is and the hippocampus is. The amygdala is part of the limbic system, and hippocampus is part of the memory centers.
I gotta get some
His
water.
memory on the MoCA was, he had 1 out of 5 on recall. So atrophy here, and then we start seeing the anterior frontal lobe. You don't even see brain here yet. You just see spinal fluid. Next slide. Next slide. Did you see the space here, space in between, and the space between here is more than space over here. And that's your orbital frontal cortex. Part of your frontal lobe. Some atrophy, not a ton of atrophy, some atrophy. Okay, this is a color picture. This is our DTI. Let me get over here so you can see.
Yeah. Step aside, brother.
You can move the microphone with you.
Yeah, please. That's an order, not a request.
So we're looking at here is
Let me interrupt you a second. Using some initials here. What is DTI?
DTI is diffusion tensor imaging,
What's it designed to show?
axonal interruption. Theoretically from traumatic brain injury. However, white matter lesions from like strokes can cause that to be abnormal as well. But I can tell you that he has no white matter lesions on his brain.
I interrupted you. What's depicted on this particular slide?
That the
Wade's just looking
green
like,
indicating a flow of axons is greater on one side than the other. There's a paucity of it on this side. Next picture is even a little bit better.
as you can see, this guy's an
Here we
idiot.
got green and blue. Really got nothing over here other than a little yellow.
He's got yellow
This
in his
tells us
brain.
that he has some frontal lobe damage.
Jaundice.
I think that's it.
Yeah, why are his sandals so small? His feet are busting out of them. Look at them toes. Jesus. Longfoot Wilson.
So, if we put all that information together, what kind of conclusions did you come to as regarding
Here we go.
Mr. Wilson's brain, his brain injuries?
Let me try to
There
remember.
are two basic conclusions. One, with the ventricular asymmetry. Ventricular asymmetry can be a normal finding, but in the setting of psychiatric disease, it indicates cognitive and emotional dysfunction.
And how does that manifest itself in somebody's conduct?
It's going to cause worse behavior. It's going to cause less thinking. It's going to cause less likely to modify your own behavior, basically.
What was the other one? You said there were two.
Evidence of some brain injury. The atrophy of his superior anterior temporal lobes as well as his frontal lobes is an important combination. When you have atrophy of your amygdala, which is one of your main points of your limbic system, it creates for emotional instability. It makes you more likely to get mad and not be able to calm yourself down. The frontal lobe impairments cause one to be more likely to be impulsive and act without regard to consequence, act without plan, more likely to be irritated and agitated. And the frontal lobe is also important for stopping behavior arising out of your temporal lobe.
Is it practical to assume that these injuries to the brain occurred contemporaneous with the traffic accidents?
The location of this, at least the atrophy, is typical
Of the what? I'm sorry.
of the atrophy, the shrinkage, where it pulls away from the skull, is typical of trauma to the brain. That's where the skull is the hardest, and that's where it beats up on the brain the most.
So if Mr. Wilson has been in custody since the date of his arrest, which was 2 days after the incident, presumably he had this same brain injury back in 2019.
Yes, but atrophy takes time to develop. It didn't just occur in the last year. It's probably been occurring over the last several years.
Is there anything that can be done to
Thank you.
repair or replace?
No, but medication can be helpful at modifying his behavior, mostly from psychiatric disease, because this isn't somebody with this injury on top of bipolar disorder, major depression, schizoaffective disorder, whatever it may be. It's going to make it worse. So if you at least treat the psychiatric disease, and basically a simple answer is this can be treated.
Okay. So the problem that you have described as a result of the brain trauma is separate and distinct from the psychiatric diseases that he has.
Yes. Most psychiatric diseases don't have a MRI finding say, hey, you have this disease. Schizophrenia, they're starting to see some findings of some commonalities between MRIs and PET findings, but nothing's been established as this is it.
Okay. So this is basically in addition to anything that a psychiatrist or the neuropsychologist may have testified to.
Yes.
May I have a moment?
You may.
Look at Wade. He looks like a wet slug. Little brain Wilson. So what we found, I guess, is there's expert rules. There's too much, quote, there's too much brain in the brain. And there's a little bit of yellow.
I do not, thank you. Good morning, doctor.
Good morning.
Now, you indicated you had an opportunity to sit down and meet with Mr. Wilson, and you conducted a series of tests. Is that right?
That's correct.
What internal validity measures were in these particular tests?
The MOCA does not have any internal validity measures. However, I find it difficult to believe that someone would fail two parts of it and do excellent on everything else. But the parts that he failed in were the things that the MRI supports that he'd have impairments with.
Okay. Well, I'm asking you specifically about the screen nerves tests, the motor exam tests, the muscle tone, the sensation, which is your deep 10 reflexes, and your assessed Romberg tests.
What about those?
Are there any internal validity measures in those particular tests?
Well, reflexes, I like to see someone fake it because that's not something you can really do. I mean, I've been in this for over 20 years. I've seen people try, but you can't fake it. Motor examination, you can also see that too. There's actually built-in validity testers when you test for leg weakness, but he exhibited no weakness, so I had no reason to believe it was invalid. Tone, he doesn't know what I'm checking for. How's he going to fake it?
Well, my question to you is you conducted these as forensic exams, did you not?
I did.
And forensic exam means that it's an examination by a medical professional for the use in a criminal prosecution. Isn't that right, sir?
Yes.
Okay. And because of this is a forensic examination, you would agree with me that Mr. Wilson has an interest in the outcome of the evaluation, does he not?
He does.
Okay. So continuing on, you conducted these screen nerves, the motor exams, the muscle tone, the sensation, the assessed Romberg tests, sticking someone's tongue out, making sure that their face is symmetrical, making sure that he can smile, whether or not he can shrug his shoulders. Those are all things that you took into consideration, and that is based upon Mr. Wilson's cooperation with you, is it not?
Yeah, those other things were normal too.
All right. Now, when we get to the MOCA examination that you had previously discussed, that's the Montreal Cognitive Assessment Test, correct?
Yes.
All right. And when we were discussing the Montreal Cognitive Assessment Test, you'd agree with me, sir, that particular test is specifically a screening device. Isn't that right?
It is a screening device, yes.
All right. And that screening device was something that you had gone ahead and utilized in this particular case. Is that right?
It is.
Okay. And are you certified in utilizing that particular test or assessment?
I am not.
Okay. Why not, sir?
Because when I signed up for that doctor who runs its program, I couldn't get into the system when I paid my bill. It was like a week later, I got my access, and I haven't done my access yet. But it's a racket.
I'm sorry, did you say it's a racket?
It's a racket.
All right. Well, isn't it
What?
true, sir, that the people who went ahead and developed the MOCA assessment, sir, they actually encourage that successful completion of the official training and certification is mandatory for anyone administering paper based on MOCA tests.
Let me get my.
Let me check my notes.
I paid something like $200 for this thing.
Brother. What? Poor guy. He's
It's
probably
run
just
by the
nervous.
founder. But it is accepted. So certification thing is relatively new.
But you've not been certified, is that right?
No, but I'm working on it.
Well,
I'm
as far as
trying
the,
real hard.
Montreal Cognitive Assessment Test, you also
Studying every
acknowledge the
day.
fact that there was no internal validity measure as it relates to that particular test. Is that right, sir?
No, but it needs to be interpreted in the setting of everything. And given where I see atrophy, it seems like it would be a valid indicator of his performance. His memory's terrible. He has atrophy in his anterior temporal area. His executive function impaired. He's got frontal lobe atrophy. So it makes sense to me.
Well, you'd also agree with me, sir, that the internal validity measure is to determine whether or not someone is giving a good effort. And you have no determination as to whether or not Mr. Wilson was giving a good effort when you conducted the Montreal Cognitive Assessment Test, correct?
Correct? Other than his performance on the rest of it was excellent. He did serial sevens without any difficulty. He remembered word and had word counting, or he was able to tell me 12 words in 1 minute that started with F without difficulty. That's usually somebody, if they're going to fake it, they're going to fake it there.
Okay, well, isn't it in fact true, sir, that Mr. Wilson has some issues as it related to the memory function portion of the Montreal Cognitive Assessment Test?
Say that one more time.
Isn't it in fact true
What?
that Mr. Wilson had some memory issues as it relates to the testing of them by and through the Montreal Cognitive Assessment Test?
Yes, on delayed recall, he had 1 out of 5.
Now, how do you know whether or not Mr. Wilson actually remembered more without any internal validity checks, sir?
I don't know that.
So would you agree with me, sir, that the
Wait, you
Montreal
remember.
Cognitive Assessment Test is not as good a measure of whether or not Mr. Wilson has a good cognitive development than those that were conducted by Dr. Eisenstein?
Eisenstein did a 6-hour battery of testing, which is going to be superior to a MOCA test.
And are you familiar with the neurological assessment that Dr. Eisenstein conducted upon Mr. Wilson?
Dr. Eisenstein did a neuropsychological assessment, and all I had was a raw testing and no report. So no.
Were you aware of Mr. or Dr. Eisenstein's testimony in this particular case?
I was not.
Are you familiar with the fact that when Mr. Wilson conducted or underwent a full neurological
Get you a sip of water, doc.
evaluation with Dr. Eisenstein, that his executive function in 6 of the 8 tests was normal?
Does 6 out of 8 suggest anything? Is that any impairment? Is that absolutely normal? I don't know.
Yeah, he had executive functioning in 6 of the 8 tests, and the last 2 tests he didn't finish, and that's the only reason why they were scored in the way in which they were.
And why didn't he finish?
Because he was tired. 6 hours.
No, he gets impulsive and frustrated.
So what specific test revealed
What?
that Mr. Wilson was impaired in the executive functioning and delayed memory when you conducted your test, sir?
It was a much shorter part. It was trails, copying a square, and drawing a clock. That was executive function.
That sounds like a kindergarten.
So are you familiar with the Dallas Kaplan phonetic verbal fluency test, sir?
Drawing a clock.
That's the counting the words. Or the word, come up with words.
Yes.
Like what that was done on the MOCA.
No, that were done
Verbal
by,
fluency.
that were done by Dr. Eisenstein.
Verbal fluency is a neuropsychological test. I don't do neuropsychological tests. I'm a neurologist. I'm limited to something like a MOCA.
I'm working
But
on it.
You've heard of the Dallas-Kaplan Executive Function System,
I
is
have.
that right, sir? Okay. And wouldn't you agree with me, sir, that that's more of a comprehensive measure of executive function than the MOCA?
Word finding is going to be left frontal, posterior broca, and not necessarily indicative of executive function. It's more indicative of language.
Well, let me ask you this. Did you see any of the neuropsychological testing that Mr. Wilson underwent that was performed by Dr. Eisenstein?
Let me see test pages.
That's a sad
Had some
bunch
raw
right
work
there.
And didn't make heads or tails of it. Oh, hang on. This is what I can do. Composite score summary on the Ways 4. Verbal comprehension, average. Verbal reasoning, borderline. Working memory, average. Processing speed, average. Full scale, average. General ability, low average.
So wouldn't you agree with me, sir, that the neuropsychological testing that Mr. Wilson underwent by Dr. Eisenstein would be of help in addressing your opinion with regards to executive function?
One limitation of neuropsychological testing is that it doesn't properly estimate premorbid function. If you look at Mr. Wilson's grades back in grade school, he had A's, mostly A's, B's, and C's. What happened?
He started doing
The point
drugs.
is, you can have a significant decline as a high functioning individual and do well on neuropsych testing. That's the limitation of neuropsych testing. It's one of the limitations I have with people coming in, I evaluate for dementia. If they were doctors or scientists, they sent to neuropsychologists, they come across as normal, but they lost 30, 40% of their cognition already. They're dementing, but neuropsych testing was normal. So neuropsych testing has to be taken with a grain of salt.
Bath salt.
So you're telling me, or you're telling us that no, the neuropsychological testing that Mr. Wilson underwent with Dr. Eisenstein was not helpful to you. Is that what you're telling us here today?
Well, as I did not have it, it was not helpful.
Okay, fair enough. So you'd also agree with me that there's actually no evidence of executive function brain damage in the life functioning or the events surrounding these particular murders back in October of 2019. Is that correct?
I wouldn't say there's no evidence. And the crime itself, I think, indicates that he has some type of impairment.
Really? And what might that be?
To strangle a woman? Did he plan to do it? Or was it an impulsive action and an overreaction?
Well, we're going to get to that in a minute. I want to talk to you a little bit about the head trauma. You indicated that you had an opportunity to talk to Mr. Wilson as it relates to the head trauma that he sustained growing up. Is that right? And you based your decision on, or your determination on, the couple accidents that he
I took all those with a grain of salt and added to his physical exam findings.
Okay.
The abnormal reflexes he had suggested that he had some type of pathology, either in his neck or his brain. But people who have neck injuries frequently have brain injury, or vice versa. They have brain injury, they have neck injury too. So I don't know if his hyperreflexivity was from his brain or his neck. But I'm here to evaluate from traumatic, evidence of traumatic brain injury.
All right. Well, Mr. Wilson, when he's talking to you about his car accidents, he never gave you any dates, times, specific locations that these occurred. Isn't that fair?
Location was Tallahassee area, but in times, no.
You don't even know when that occurred, right?
I do not know.
You don't even know if that occurred. Is that fair?
As I have no medical records, as he didn't go to the doctor, I don't know.
Right. So you're relying solely upon what Mr. Wilson is telling you. Isn't that correct?
I'm taking it with a grain of salt. If his neural exam was completely normal, I would have a hard time believing it. But it wasn't normal, so I had to believe him.
Well, you also indicated that you had reviewed something involving his sister, Dr. Wendy, who happens to be a radiologist. Were you aware of that?
I knew she was a doctor, but I didn't know she was a radiologist.
Would it surprise you, sir, that when Mr. Wilson actually had an accident, that he went to the hospital, that he had CT scans that were done?
In 23, or when?
When he had his accident, sir.
I didn't know that. I didn't have a CAT scan.
I don't know.
Well, would it surprise you to learn that his sister also had gone and reviewed those particular CAT scans and found them to be normal?
A CAT scan being normal simply means that there's no evidence of acute trauma. There's no evidence of blood. There's no evidence of subarachnoid hemorrhage, epidural hemorrhage, intraparenchymal hemorrhage, or anything that a surgeon has to deal with.
So when Mr. Wilson was telling you about all these various injuries that he sustained to his head, did you do any follow-up to corroborate any of the information that he had provided to you?
As I was aware that there were no medical records, I did not look for no medical records.
Well, did you bother to ask him for any further specific details as it relate to the accident? Whether it be on the beach or in the Tallahassee area?
I did not, because there was no medical records to support it, and there's really no point in getting more details about it. There's no medical records.
Yes, I do think he'll get the
You
death
also
penalty.
told us he had a couple sports injuries whereby somehow he had gone ahead and bumped his head and lost consciousness, once during a football game and once during a baseball, but he didn't tell you when those occurred. Isn't that correct?
He did not know. I assumed they're in high school.
You're assuming a lot of things in this particular case, are you not, Doctor?
Objection, argumentative.
Sustained.
Now, Doctor, you indicated that you had an opportunity to review a series of scans in this particular case. One happened in April of 2023, and the other happened where you had an opportunity to review an MRI scan of August of 2024. Is that correct?
This is correct.
And you also had the opportunity to review the records that were contained as it related to those scans in April of 2023. Isn't that correct?
I looked at my records. I do not have that scan. I do not have it. So, but I'm told it's normal.
Matter of fact, the impression was there was no acute intracranial abnormality.
Again, it was a CAT scan, which looks for acute blood. That's what CAT scans are for in trauma. Looking for blood, looking for epidural hematoma, subarachnoid hemorrhage, intraparenchymal hemorrhage, any kind of blood anywhere.
Well, you'd agree with me, sir, that a non-contrast head CT remains the imaging of choice for patients that are presenting with an acute TBI. Isn't that correct? Or traumatic brain injury.
Yes, because that's the test that determines if we had to do anything at that point in time. It's not meant to be the total evaluator.
But in this particular case, in that particular time, there was no acute intracranial abnormality that was found in the CT scan, correct?
Correct.
And that was done by a radiologist.
It was done by a radiologist and technologist, but read by a radiologist. The CAT scan being normal does not say he did not have a concussion. If I had to count the number of people who had concussions in normal CAT scans that I've seen, you wouldn't have enough things to count with.
Well, doctor, you'd agree with me that radiologists are trained to read and interpret medical images, correct?
They are.
And it's their specialty to diagnose and treat conditions using imaging equipment, right?
Yes.
Matter of fact, they perform all the radiology modalities, which include x-rays, ultrasounds, nuclear medicine, MRIs, CT scans, PET scans, and the such, correct?
Yes.
They all have, and you'd agree with me, all those modalities have different properties and they produce different images in different anatomic planes, correct?
That sounds reasonable.
And you'd also agree with me that radiologists also review thousands of images in a typical week.
Depends on the radiologist.
And you'd also agree with me that they know how to combine findings of multiple different studies to render a diagnosis, right?
Most do, yes.
And in this particular case, sir, isn't it in fact true that when you had respectfully requested that Mr. Wilson undergo radiological assessment, that one of your requests was that you did not want the radiologist to interpret any study unless mandated by the institution? Isn't that correct?
That's correct.
And why is that, sir?
Because radiologists make mistakes, and a mistake such as reading something normal when it's not normal is very hard to undo.
Matter of fact, isn't it in fact true, sir, that you look at it for, I'll make sure I get the language correct. A radiologist does not look at it from a criminal perspective. Isn't that correct?
Yes, for example, the ventricular symmetry. Ventricular symmetry is a normal finding, but in the setting of psychiatric disease, it means something else. The doctor reading it had the information that he had a psychiatric disease. And that's just an example.
All right, so a radiologist would be looking at it from an objective point of view, and when he found that there was no intracranial abnormality, he would be wrong?
Mr. Bean.
The
Dr.
ventricles
Bean.
are symmetrical. If they said they're normal ventricles, that's wrong. They were asymmetrical. So that would be a misdiagnosis by the radiologist.
Well, let's talk about that. You had some MRI scans that you had the opportunity to review that were taken on August 21st of 2024. Isn't that right?
That's correct.
Matter of fact, the MRI scans also revealed that there was a unremarkable conventional brain MRI examined without contrast. Do you agree with that assessment, sir?
From a perspective of major disease, stroke, MS, anything you look at, yeah, it looks normal.
Happy birthday, Ashley.
Matter of fact, the findings in the MRI scans were that the ventricles are normal in size and position without evidence for hydrocephalus.
There is no hydrocephalus. In fact, the ventricles are relatively small, indicating that he may have increased intracranial pressure.
And then we also find that the fourth ventricle is midline and no shift is noted, right?
Yeah, that's brainstem. That's fine. It also says that no, it alludes that neuroquant was not done. No computerized evaluation of the MRI was performed,
Well,
which is not order.
in order to do a neuroquant, wouldn't you agree with me that that's just a computer analysis to quantify those matters? Isn't that right?
It is, and also to put validity in what I'm saying versus what the radiologist is saying. Who's right? Who's wrong?
Well, if there's really nothing to quantify, then why do a neuroquant to begin with?
The ventricles are asymmetrical. That would showed up on neuroquant. His anterior temporal lobes are atrophy compared to the rest of his left parietal lobe.
Parietal lobe.
When we're talking about the MRI scan and the CT scans, both of the radiologists that had gone ahead and reviewed both of those particular records found them to be normal. But you're telling us here today that you found abnormalities.
Abnormal as it regards to behavior. When you have asymmetrical ventricles and you have some relative atrophy compared to the rest of the brain. These are not gross abnormalities.
All right, let's talk about his behavior a little bit. Do you have any independent corroboration besides what Mr. Wilson told you on that
Why'd they do that?
day when you did the assessments and
Look at,
reviewed some of the records in this case?
get them some bigger slippers, please.
Homicide that took place on 7th of October of 2019.
The homicide itself, I was looking through my records. And I have no documentation of the action of the
Foot
murder.
cam.
All I saw was I was able to see online, and I don't know if that's correct or not, so I can't testify to it.
So you have absolutely no idea as to how Mr. Wilson was acting and or reacting and or interacting on the 7th of October of 2019.
All I can say is that based on what I found, he's more likely to be easily agitated, with difficulty controlling that agitation and acting upon that agitation with regard to consequence.
But you were telling us earlier, what were the types of items that you had to review in this particular case?
The juvenile justice face sheet, all the things he did, all the burglaries. And a boatload of jail medical records from 17, 18, 19. A letter from his sister. And that's about it.
That's it.
I just have I have hundreds and hundreds of jail records. And I could not find any Lee County hospital records in my jail records. So I don't know what you're finding.
Well,
Hmm.
wouldn't you agree with me, sir, that when you are in the process of diagnosing someone, that it's also important to make sure that you have some support for that particular diagnosis?
It would be great if I had something. Most of these these convicts don't go to the hospital. They don't have hit their heads. They don't go anywhere. They run from the law. They're always in trouble, and they refuse medical care. So consequently, I have no medical records.
You'd also agree with me that a lot of individuals aren't exactly forthcoming when they relay history to you as it relates to them. Isn't that correct, sir?
This is true. They had secondary gain.
So wouldn't you agree with me that it's important to see how a person functions in his everyday life, to have a kind of a baseline?
I gleaned a bit of his behavior, judging from how many times he was in juvenile detention and his complaints while in juvenile detention, all the depression, the anxiety, and all before he was in jail for this. He's been battling mental health disease for a long time.
Well, are you also familiar with the fact that Mr. Wilson is also engaged in drug use over that period of time as well?
Yes, I am.
So whether or not a lot of these things are attributable to drugs versus a physiological aspect, you'd agree that's hard to discern. Isn't that not true?
It is, but why do people use drugs? To escape their mind.
To escape their little ventricles.
Let me ask you this, doctor. What efforts did you undertake to ensure that Mr. Wilson was telling you the truth?
There's literally nothing I could do. The only way I can tell if they're telling me the truth is if I have medical record support of what they're telling me. He told me that he was on medication, that I can verify. So with some of the medications he was on, that I can verify. But as far as the head injuries, nothing's documented about those. So I have no idea if that's true or not. I suspect it's true because his brain supports it, but I don't have any records to corroborate it.
Well, did you have the opportunity to review a statement that was given to law enforcement by a gentleman by the name of Joshua Lukic?
That does not ring a bell.
Well, Joshua Lukic is an individual who called 911 regarding Mr. Wilson telling him that he had just killed 2 individuals. You didn't have the opportunity to review that statement, did you?
I did not have that statement, no.
Matter of fact, you didn't have the opportunity then to listen to that 911 call, did you?
I have not.
Uh-oh.
Did you review of the statement by Miss Stephanie Johnson, who was with Mr. Wilson throughout the course of the evening and the morning of the murder of Miss Christine Melton?
I have not seen any statements.
So you don't know what, if any, effects or symptoms Mr. Wilson was undergoing back in October of 2019 when he committed these murders. Isn't that fact true, sir?
The thing I'm testifying to is that his brain is such that he's more likely to be impulsive without recourse to consequences, easily agitated, and easily this fits within the realm of possibility.
Well, it also fits in the realm of other possibilities, does it not?
Objection, speculation.
Overruled at this point.
What are you talking about?
Well, you're assigning his actions to one particular.
Well, it's going to be multifactorial. Yeah, this is just one aspect to his behavior. He's going to have drug use. He's going to have whatever is going through his head at the time. This is just one aspect that makes him more likely to do something awful than not.
Well, did it affect his ability to have a relationship with an individual back in October of 2019?
It doesn't stop him doing that, but it likely makes him more likely to be tumultuous.
How do you know?
I'm just saying, from his abnormalities, this is behavior that I would expect. I don't know it. I expect it.
Well, did you have an opportunity to corroborate any of that information? Did you have an opportunity to speak with a young lady by the name of Miss Melissa Montanez?
I don't know who that is, so no. But I had an opportunity to see him overreact and do things that he didn't want to do just when I was doing the mocha. I saw that behavior right there.
Well, is in fact true, sir, that you didn't have an opportunity to see how he was acting back in October of 2019?
I met him last week. How am I supposed to know what he did in 2019?
Well, aren't you here to explain his actions back on the 7th of October of 2019, sir?
Based on his neurological abnormalities only.
You don't know what his ability was and what was going through his head when he went to a music venue that night, did you?
As ventricular asymmetry is typically congenital and atrophy takes time to develop, I would position that these findings are likely predating 2019, probably sometime after he was a teenager.
Well, if they're
Or as a teenager.
predating 2019, you would expect some kind of symptoms to be present at that point in time, would you not?
Impulsiveness, agitation. How do I know it's not there? I would say that it's likely that he had those things then.
Really? Well, you didn't bother to go ahead and speak to Mr. Lukic or Miss Stephanie Johnson, who had contact with him. You didn't have contact with Miss Melissa Montanez, who could tell you a little bit more about.
It's supposed to be at 2
contact
o'clock
with
today.
Mr. Wilson, did you, sir?
I did not know them. How am I supposed to contact them?
Well, you had the case report, did you not, sir?
I did not have the case report, no.
You didn't have the case report as it applied.
I did
to
not
Mr.
have any of that,
Wilson.
no.
Sir, do you remember giving a deposition yesterday?
No, I don't remember that. Yeah, I remember yesterday.
All right.
Oh, sassy.
Matter of fact, one of the questions I had specifically asked you was whether or not, and I wanted to make sure that I understood you correctly, was that you said you had a criminal justice face sheet, you said you had a case report, you said you had a series of medical records, you had a letter from Mr. Wilson, and then you had a school records. And I asked you if that was accurate.
I had a face sheet, but it was Department of Juvenile Justice face sheet.
I also asked you, sir, whether or not you had a case report. You told me that it was accurate.
I must have misspoke because I do not have that.
So you misspoke twice?
Objection, argumentative.
Overruled.
It's a record. I have. a bunch of records that are all that look like jail medical records that are all a couple hundred pages each of just mundane information.
Gotta use the bathroom.
So,
I'll be right back.
Yes, I misspoke twice.
So getting back to October 7th of 2019, did you have an opportunity to speak to some ladies by the name of Shayna Williamson, Dawn Griffin, and Amy Slobodian about what they saw?
I
when
did
Mr.
not.
Wilson was
I do not know who
battered?
they are. I didn't know they were involved. And I did not talk to them, no.
Did you have an opportunity to review a statement of an officer by the name of Timothy McCormick, which depicted his
No, I did
contact
not.
with Mr. Wilson?
I did not talk to anybody, so I'll save you some time.
Well, did you have an opportunity to watch the video of the interaction between the officer and Mr. Wilson?
There's a video? No, I did not. I don't have that video.
Did you have an opportunity to watch the video of the interaction that Mr. Wilson had with the audio of the interaction that Mr. Wilson had with Detective Nick Jones?
No.
Did you have an opportunity to listen to any of the jail calls that Mr. Wilson had made to a number of individuals?
No.
Have you had an opportunity to review any of the emails, numerous emails that Mr. Wilson has gone ahead and sent out?
Didn't have them, so no.
So if he was able to recount details of the murder and those details were backed up with evidence, you'd agree with me that his executive functioning or his ability to remember these items and what you have gone ahead and learned as a result of your assessment of Mr. Wilson may not necessarily be accurate?
Long-term memory and memory events that are very impactful tend to stick better than shoe, red, velvet.
Well, when Mr. Wilson goes ahead and kills Miss Melton early in the morning, proceeds to attack Miss Montanez shortly thereafter, and then goes ahead and kills Ms. Diana Ruiz within a matter of 6 hours, and then goes ahead and reports that to Mr. Joshua Lukic, you'd agree with me that's relatively short-term memory, would you not?
What I missed.
Those are major events. People tend to remember. Those are harder to. I mean, he's not demented. He just has some short-term memory loss. He has impairments. He's not totally out to lunch.
He asked about the jail calls? Dang it.
So, doctor, if he's not exactly out to lunch, then is it fair to say, sir, that
Is it fair to say you're a Jumpsuit Pablo fan?
function in normal society without a lot of those symptoms, effects that you were talking about earlier?
I'm not saying he's incompetent. He has impairments that makes him more likely to be impulsive, easily agitated, and do things without consequence.
You said that he couldn't think these things through?
Not in the moment. And in addition, because of amygdala atrophy, he's less likely to be able to calm himself down in a reasonable time.
Me.
How long would it take for him to calm himself down, sir?
It depends on what's keeping it going.
Well, if he had atrophy, that indicates that he would have some kind of loss of brain mass, correct?
He has reduction in brain mass. It's not gone. It's reduced.
Well, if you have loss of brain mass, wouldn't you also have ventricles that would increase in size?
Not when it's on the outside of the brain, such as the amygdala. His lateral horn is actually relatively large considering the rest of his ventricles. So The lateral horn of the temporal tip is a little wide, considering the level of ventricular size elsewhere. So, yes.
Let me ask you this last question. Would you agree with me, sir, that you're attempting to correlate brain changes that you observed in Mr. Wilson to predictive behavior?
That would be my limitation, yes.
So what you're telling us here today is that you would have been able to predict that Mr. Wilson would have gone ahead and committed those murders back in October of 2019 of Miss Melton and Miss Ruiz based upon his changes in his brain. Is that what you're telling us here today?
No, only that he would be more likely to than the average individual.
I have no further questions.
Just a couple, Judge, please. Now, you had a chance among the materials that you reviewed was a CAT scan from 2023. Is that correct?
I have the actual CAT scan.
Okay. And that CAT scan was administered because Mr. Wilson had head trauma in 2023.
Yes,
So he had head trauma that he didn't even report to you on top of the other head trauma that he did report to you.
correct.
Now, just for clarification, CAT scan normally done at the hospital, like right after an accident.
Yes.
They don't always do an MRI.
No, MRIs are more expensive. They take longer, and you need something in the emergency room to be very quick. CAT scans are quick, and they tell you what you need to know. They tell you that whether there's a hemorrhage, again, skull fracture, epidural hematoma, subdural hematoma, subarachnoid hemorrhage.
Something
Those are
that
things
you
you're
want-
looking for.
Something that you want to know so that you could act in an exigent circumstance in order to stop that.
Right. If he needs to be referred to neurosurgery and have a hole put into his head to drain a subdural hematoma, then he needs to have that done. But there's no bleeding, then there's really nothing to get overly concerned about. Because if there's like enteroparenchymal hemorrhage, then they'd be admitted for watching for swelling, and they need to have a flap put in their skull. And that,
But if he has brain trauma, that wouldn't necessitate a CAT scan, would it?
brain trauma.
Yes.
Well, typically you do a CAT scan if there's head injury because you got to make sure that you don't miss a bleed. If you miss a bleed, you're gonna get sued.
All right, but do you have to have a bleed every time you have brain trauma?
No, most of the time you don't.
So a CAT scan wouldn't help you if you're trying to do the analysis that you were trying to perform.
Long jaundice.
Only if it's grossly abnormal.
The test results from Dr. Eisenstein, you had an opportunity to review those?
The test sheets,
Yes.
yes, I couldn't make heads or tail of them.
Okay. But nothing in there stood out as being inconsistent with your diagnosis here today?
No, because I couldn't make heads or tail of them.
Okay. But I mean,
Heads or tails.
he's in there reviewing, he's a neuropsychologist. Just because it says neuro,
No.
he's not testing for the same thing that you are. Is that correct?
That's correct. Neuropsychologist is different than neurology.
All right. So as a result of his testing, his testimony, that of the psychiatrist, Dr. Mills, they're more focusing on things like the bipolar and it's not schizophrenia.
Schizoaffective disorder.
Schizoaffective disorder. They're focusing more on those types of things.
All right.
And you're looking at long-term brain injury, for lack of a better term.
I'm looking at neurological consequences of trauma and development.
Okay.
And ventricular asymmetry is important because he has psychiatric disease.
You mentioned the term atrophy a few times. Would you contemplate that there would be additional atrophy in the future?
I would, this is me speculating, so I don't know, but as he ages and there's general atrophy, he'll have more atrophy in his frontal lobe and his temporal lobes.
Okay. But you said medication may help?
Medication could adjust behavior at modifying some of the impulsiveness, the agitation.
It's not going to regenerate brain tissue.
No, it's not gonna bring it back, but it could be treated.
Were you aware that he had consumed drugs that evening before he committed any of the homicides?
I was aware of drugs, yes.
Do you know what type of drugs?
No, because I was aware because I read it online somewhere.
Okay. Would controlled substances, depending on what it was, aggravate the anticipated conduct of Mr. Wilson?
It all depends on what it is. I mean, marijuana would tend to calm someone down. Methamphetamine would make him much more agitated, and any kind of the stimulants would make him more easily act without thinking.
So there are controlled substances out there, depending on what he took, that could have made him a lot worse that evening.
Yes.
Now, the fact that Mr. Wilson killed a woman with his bare hands at some point in time during their conduct with each other, then a couple of hours later, he goes out and he savagely attacks his girlfriend. And then a couple of hours after that, he goes out and kills another woman. Is that the type of conduct that you would expect and anticipate from somebody with his brain injuries?
His brain injuries, his psychiatric disease, as well as the drugs he's on, likely resulted in this awful behavior.
I don't have any further questions.
Anything else?
No, Your Honor, thank you.
All right, you may step down.
Thank goodness. Good Lord. That mouth is dry, huh? It needs a cup of water.
Okay, do you have any other witnesses?
No.
Okay. You do? Okay, yes, all right. We'll take a 10-minute recess, come back then at, well, a little bit more than 10 minutes. Come back at 10 minutes to 11. So 10.
All right. Look at Wade. What's he saying? What do y'all think he's saying right now? Let me know in the chat. Excuse me, ma'am. We're trying to make fun of Wade. He just asked her if she could put money on his kiosk. This guy. Look at